we're looking at the responses of the COVID-19 vaccine. And so the hypothesis of our study was, did the results, the responses that people had from those that received their vaccine at MedCenter Health and participated in our study, how did that compare to the clinical trials?
So this study is based on an online survey that we constructed. And it was really intended to measure and get a read on people's experiences with having gotten the vaccine. So we asked them somewhere on the order of a couple dozen questions. You know, what types of side effects did you have? How severe were your side effects? And what was your motivation for getting the vaccine, as well as some basic demographic information, age, gender, and those sorts of things. And the reason for doing it was to really compare what we see in the real world with the rollout of the vaccination to what was seen in the clinical trials, and to ask questions a little bit more specifically. You know, were there differences between Pfizer and Moderna? Were there differences between first doses and second doses? Were there any other factors that might influence the extent of someone's side effects, and so on?
And we were able to take the survey questions that we got, the answers to those, and compare those self-reported surveys to the ones that they got from the Pfizer and Moderna vaccine when they did the original research.
The biggest take-home, I think, from this study is that our results really validated, really confirmed what was seen in the clinical trials. The range of side effects that people experienced were very, very similar in both the types of side effects as well as the very mild severity that people experienced. So that's very reassuring, right? Because it gives us real-world confirmation that the clinical trials were truly demonstrating that the vaccine is safe and effective. There was really nothing terribly surprising in the results, which again is a good thing. Because we didn't see anything that hadn't been anticipated or hadn't been reported in the literature. In fact, we saw that there were no instances in our study of some of those very rare, more severe side effects. Again, a lot of reassurance there that the vaccine is safe and that the side effects that people experience are typical for any type of vaccine and mild in their severity. One of the things that we did find, though, was that the reactions were a little stronger with the Moderna the vaccine than the Pfizer. They were a little stronger on second dose versus first dose. And looking ahead, when we start thinking about boosters, for example, people that had COVID previously experienced side effects with their first dose, which were more similar to what those of us who hadn't been exposed or hadn't experienced COVID got with our second dose. But the COVID positive people, their second dose was no worse than anyone else's. So it seems like, at least based on the limited evidence that we have, that the reactions sort of reach a peak. And going forward, you know, we think perhaps that's what we might anticipate as people start to get boosters.
So we know that there's people in the general public that are hesitant. They've been hearing a lot of information from a lot of different sources about what the vaccine does to you, what the side effects are, and I believe that we hope that people can take the results that we've gotten and look at them and help make an informed decision for their own health in regarding the vaccine.
Through the Western Kentucky Heart and Lung Research Foundation, you will see a lot of different types of research projects. So if you have any interest, please look through the website and please let me know if there's anything I can do to help.